Confirmed cases from August 1, 2016, December 7, 2017, photo, Michigan.gov. Southeast Michigan is in the midst of a serious outbreak of hepatitis A cases, with health departments reporting about 10 times the number Michigan health officials usually see. The Michigan Health Department reports 583 hepatitis A cases and 20 deaths in southeast Michigan since August 2016. Brought into the public eye by an unusual number of restaurant cases, health officials say the majority of cases are among drug users, the homeless and current and former inmates. The majority of the outbreaks occurred in July through October and since then has fluctuated but overall has been declining from the summer peak. State and public health officials are rallying to contain the outbreak. Health departments have increased awareness efforts by notifying the public and urging vaccination, which imparts lifetime immunity, to prevent the outbreak from spreading. This is extremely unusual. It's about 10 times the amount of our normal cases, said Angela Minicusi, spokeswoman for the State Department of Health and Human Services. We are dealing with a serious outbreak and our goal is to contain it and make sure those exposed are vaccinated. Lieutenant Gov. Brian Calley announced on November 1 the activation of the State Emergency Operations Center to coordinate the state's response to the outbreak. The Community Health Emergency Coordination Center, a federal government agency which provides emergency community health care, also was activated October 31 by the State Health Department to help in prevention and investigation of cases. Hepatitis A is a vaccine-preventable disease. If given within 2 weeks after exposure, the vaccine can prevent the illness. The outbreak, however, comes at a time when there is a limited supply of the vaccine due to a national shortage, health officials say. Symptoms include abdominal pain, nausea, vomiting, diarrhea, dark urine, clay-colored stool, fever, chills, yellow skin and eyes, jaundice. Symptoms occur between 15 and 50 days after exposure and can last for several weeks to months. The virus is usually spread from person to person by consuming something that has been contaminated with the stool of a person with hepatitis A. Minicusi said there is no particular source of infection in the recent cases, but it is being transferred directly person to person and through illicit drug use. Those with a history of injection and non-injection drug use, homelessness or transient housing, and incarceration are thought to be at greater risk in this outbreak setting. Notably, this outbreak has had a high hospitalization rate, according to the State Health Department's website. Hep A can also be spread by infected restaurant workers, which is why health officials spread the word when restaurant cases are discovered. A food handler could take their phone to the bathroom, properly wash their hands, but get germs on their phone. Food handlers could also be parents and may not wash well after changing a diaper, said Drive. Ruta Sharangpani, the Wayne County Health Department's medical director. The most recent cases in Metro Detroit were reported at Greektown Casino in Detroit in November.